So basically, these are three types. If they wanted to divide on the commercial plans, okay, if they wanted to divide, it's like three types: indemnity plan, managed care plans, and consumer driven plans. We will see in detail all these three. So basically, indemnity means like the way in India, if I wanted to go to any doctor, I have a freedom of choice. I can go to any other doctor and take a treatment and comes back to home. Then I can file a claim. I'll pay to the doctor, okay, and comes back to home. I will file an insurance to an insurance company. I'm getting a reimbursement back. There is no concept of PCP, or there is no concept of referral authorization. I don't need anything, right? I
Yes.
can go to any doctor. That's where indemnity. And on the other side, managed care. Why managed care plans has come? There are some drawbacks on the indemnity plan. There is a lot of freedom here, right? But that's coming with high premium, basically. Okay, so that's why the managed cares has started. Okay, and we have various plans over here. We will see, and then what it means of consumer driven. Any guess? Consumer driven. Who generally a consumer?
The patient or insured.
Okay, you are very close to that. Yeah, actually, we as a consumer, if we are taking an insurance, we as a consumers, right? And on the other side, employers also a consumers, right? Employers also like taking insurance
Yes,
for
yes.
their employees. That is also, one of the thing, like, they are also consumers who actually the end users, like, the consumer is an end user, basically, who actually receiving the services. So consumer driven, and then they come up with this consumer driven as well, right? So the reason is there are some advantages. The example I have told you long back on the Infosys company, they want to
Yes.
run their own insurance that will come under consumer driven, okay, health plan. Okay, and we will see what are other sub plans in each area. Okay, so this is at high level. Okay, in the commercial space, wherein the other side, the government side, like Medicare, Medicaid, and all, okay, that we are going to see, but that is a TRICARE also. That's from the um, government sponsored plans. You can see in commercial plans, Unity is the one. We even in the US, when they started somewhere in 1990s, they have these kind of plans, like, fee for service kind of, wherein you go and pay for the service and comes back to home and file a claim if you want. But that is coming with kind of. Instead, you have a commercial plan for managed care plans. Okay, managed care plans, like, there are three types. Which one? Well, the first one is HMO, second one is PPO and POS. Okay, and there is one more also, EPO, exclusive provider organization, but we don't need that. But I'm just telling you, EPO, okay, which is again a combination of one of these two. So if you see HMO, PPO, POS, we are going to see this in detail what it means. Okay, and the commercial side, HMO, PPO, PEO, yes. You have to remember that, by reading maybe one or two times, you'll get it. Okay, so in the indemnity, if you see, indemnity plans are like fee for service kind of, wherein provider, the member has a choice, go for any provider and take the treatment, but he has to pay with high premiums. The member is eligible to visit any provider of, oh, sorry, the member is eligible to visit any provider of his choice. Okay, he has to pay the provider for the service availed and then file a claim for reimbursement for the same. Indemnity plans, there is no concept of network, and member can avail the service of any provider. Means no in network, out of network concept. So the advantage is there is no primary care physician where you go and see first him, then only take referral or authorization for, to see a specialist and all. Okay. And indemnity plans offers maximum freedom of choice to a member to choose a healthcare provider. No need a referral kind of. But the disadvantage is high premium, and preventive care is not covered. That means you cannot visit multiple number of times. You have to pay every time. Kind of routine checks are not there in the indemnity plan. It's like same what we have in India, in other words. Okay, so, and then from indemnity wise, they have some drawbacks, right? So everybody don't want to pay high premiums. Not everybody, can able to pay that premium. So there are some managed care plans. They were evaluated later on. So indemnity plan provides a greater flexibility to a member to choose a provider. The freedom comes with very high cost. Member have to pay heavy premium and need to meet deductible before they can start claiming the benefit. People who cannot afford to spend large amounts on their healthcare, indemnity plan is not a good option. So then managed care plans has been evaluated. So any questions?
Yeah.
You are good, huh?
Yes, yes.
Okay,
Sorry.
okay. Okay, and let's see, the HMO is one of the managed care health plan, the first one. Okay, health maintenance organization. Okay, HMO is the first plan they launched. Okay, HMO, what they are saying is you must have a PCP. Okay, for example, I am a member, I want to take a commercial plan of HMO. It was there as a first plan. Okay, there are some drawbacks in HMO. That's why some other plans has come. Same like indemnity rate, the cost of premium is high. That's why managed health care plans. Managed care plan as well. There are three: HMO, PPO, POS. In fact, four EPO. But why they have come? There are some drawbacks to cover some of the other people. They have various plans. So then HMO is a managed care organization wherein a member must have to choose a PCP. Okay, and if PCP suggests, then only he will visit a specialist. Or if he wanted to see an out of network provider, the PCP referral is mandatory. So and there is uh, there is no, they're very small copay every time, and a very small or very small amounts they will pay from their pocket over here, because they're having a PCP, and there is a lot of freedom of there is no freedom basically, because he has limit to PCP. That is a drawback. But the advantage is they're paying very low out of pocket amounts, low premium. This plan is coming with very low premium. Okay, and under HMO, they are saying staff model HMO, group model HMO. Just staff model HMO, you already know, like, a group of doctors and forming a group and then making a contract with an insurance company. Okay, that is called staff model HMO. And the other side is group model. Okay, so a group of physicians who are working independently, making all independent practitioners forms a group and make a contract with insurance company. That's called a group model. Basically, only thing is, there is an organization who have a set of doctors. If they wanted to work for a health insurance company like an employees, they can be enrolled into that staff model HMO. Wherein other side, who are individuals who whom they wanted to wanted to make a services to insurance company, then they can come forward and enroll them into a group model, so that they will form a one independent practice association kind of a group and then serve it from there. Just those two models, basically the way how they make a contract with an insurance company. Providers of HMO has capitated contracts with the organization. That means they are getting a fixed fee, kind of, irrespective of number of services or the number of times the patients are visiting. Okay, that's why the preventive care is there. So the patient can visit n number of times, so they get a preventive care. The doctor will always keep suggestions and all, and try to eliminate the number of visits. That's why here, the more preventive care is there. If you see advantages, the advantage is the cost is low out of pocket amounts, okay, and minimal co-payments. And HMO encourages preventive care. HMO generally do not place a limit on the members' lifetime benefits. So there is no limit basically. So as much as you are claiming, they will be reimbursing. But the disadvantage is there is no freedom of choice, right? I have to go to PCP only. So that's the thing. Like, every member might not be interested to go to PCP before seeing a specialist and all. So I have a lot of money. Why do I need to have that control? Why I don't have, if I have a plan wherein I have a freedom of choice to go to any doctor, wherein I can choose that plan. Okay, and except in case of emergencies, HMO members are required to obtain a treatment. So basically, what they're saying is only for emergency kind of a service wherein you can go to a specialist without PCP referral and all. But is it clear?
Yes.
Moving on to the POS. Instead POS, I'll cover PPO and I'll come back to POS. So the name itself saying PPO means Preferred Provider Organization. Okay, that means it's a freedom. The member has a freedom to go to any doctor. Okay, so that's where this managed care plan has come, but it has split into two parts. Like, in case if you go to a PCP and take a treatment, the cost will be less. But in the same case of PPO, if you are going to out of network provider, yes, you have a choice to go to any doctor, but if it is an out of network provider, the amounts which you are paying from your pocket will be a bit high. Okay, so here you have both the ways. If you go an in-network provider and choose a PCP and get a treatment, so your out-of-pocket cost is less. But you still have a freedom of choice to go to outside of a provider, but that is coming with bit of high out-of-pocket amounts. So if you see, PPO physicians provides medical services at discounted rates by providing incentive to a member using designated healthcare provider in network use. PPO members usually pay per service as they are rendered. The insurers then pay the covered amount directly to the healthcare provider, and the member pays his or her co-payment amount. The main advantage is the freedom of choice to go to any doctor and option to go to out of network at lower benefits, and also preventive care is there over here because you have a in PCP concept as well over here and less cost if you see a PCP. But disadvantage is most PPO have larger co-payment amount than HMO, more premium cost than HMO because you have a freedom of choice here. It's a bit high in premium. Okay. So any questions on PPO?
In India, we have these options.
It's PPO only, most likely.
Yeah.
Most likely it's like an indemnity plan. In other words, if you see this like it's a kind of an indemnity plan, but yeah, it's still there. Like, if you go for Tata AG or any insurance, they'll give a list of doctors basically. Okay, so when we are enrolling, they'll say us they'll give you a document, basically a booklet, wherein they're stating that these 100 hospitals have a tie-up with me, you go to the doctor. But as I said, there might be 101 doctor you wanted to see, you can still see, but you will end up with paying a bit higher out-of-pocket amounts. Okay, right? The insurance company might not be reimbursing that much. See, the reason is when you have a contract, right? The provider has a contract with an insurance company. During that contract itself, there are negotiated rates, right? For
Yes.
any service, there is a less amount they're going to charge, not unlike to the others, right? But when you go to out of network, you are not part of that network, so he will charge more because he might visit only once or twice in a lifetime as an out of network provider, so you will charge a bit more, and he don't have a contract with an insurance company. But the advantage, why when there is a contract, when they're providing with less, the reason is they'll get n number of patients. Secondly, they may get an incentive or a bonus. Okay, when they're performing really well, they'll get that additional advantages. Okay, so this is where only the thing is, if you go and in PPO, one line you need to remember is freedom of choice is there. If you go an in-network provider and see a PCP, get a treatment done, your cost will be very, very less. And you still have a choice to go to out-of-network provider, but it comes with a bit higher cost. I mean, higher out-of-pocket amounts and all. Okay, where in HMO, you cannot go like that. Okay, you always has to see a PCP, take a referral. When he refer only, you can able to visit to specialist. There is no freedom for you to go to out-of-network provider or a specialist too. Okay, and other side, we have POS. Okay, basically, they say like point of service. POS means it's a combination of HMO and PPO. Okay, HMO, PPO. What they say, if it is like, if you are seeing PCP, and if you are choosing a PCP and taking a service from that, it works like a HMO. And if you are, HMO. And if you are just going an out of network provider and you are acting like, out of network provider, then it acts like a PPO. Okay. So just basically a combination of HMO and PPO. So POS plan has two benefit level. When a member uses in-network benefit, POS plan mirror of HMO. Okay. Member must choose a primary care physician who is responsible for all referrals with the POS network. While using out-of-network benefit, the POS plan pays at lower benefit level. That means like a PPO, wherein the plan pays less, but you pay more from your pocket because you are being the out-of-network provider. Advantage is increased freedom to choose provider compared to HMO, and member pay only a nominal amount on in-network care, a less amount, and generally no deductible is required for in-network services, while there is no PCP for out-of-network service, and no PCP concept if you wanted to go to out-of-network. No need to say PCP. That's the advantage. But again, disadvantage is if you go to out-of-network, you will end up with paying high out-of-pocket expenses. As an HMO member must choose a PCP, that is also one disadvantage, because it's a combination of HMO and it's again depends. Like this plan may attract more people, right? Like for example, I wanted to go to PCP, and I think like I might not need to go to out of network. Then I go and take this plan, and always I go and in network. Then that time the charges will be very less. But in some cases, if a specialist is needed, I go to out of network. That is only one time where I'm paying more amount from my pocket. That is not there in HMO. Only PCP has to refer you. Okay, and without referral, if you go, we have to pay entirely from our pocket.
Yes.
So there is a tabular form, where is a comparison will be there, and try to remember. So indemnity plan is like a, no, very high cost, high premium. You will get this because you have a lot of freedom. No PCP, nothing. Okay, no limits for your lifetime thing. You can claim as much as you are seeing a doctor. But HMO is a kind of PCP thing, wherein you need a referral to visit a specialist. PPO is freedom of choice is there, but it is coming with a bit higher cost. POS is just mirror of HMO plus PPO. So let's see referral slash authorization. So does it require an indemnity plan, referral or authorization? No, right? In case of an indemnity plan.
Yeah.
And HMO,
It's
referral
required.
is required because PCP is there. Okay.
Yes.
And PPO, preferred provider organization. The name itself is saying preferred provider. I don't need any referral or authorization, right?
Yes.
POS, place of service, still required because it's a combination of HMO plus
HMO,
PPO.
PPO.
Yeah. And OOP cost in indemnity plan, coinsurance and deductible will be there. Okay. And copay is not there here. You go to n number of times, n number of doctors. But in HMO, copay is there, but you don't have a deductible over here and coinsurance over here. And PPO, copay, coinsurance, deductible, all three are there. And POS, copay, coinsurance, deductible is there. Anyhow, it's a combination of both two. So the maximum thing they cover here, copay, coinsurance, and deductible. Use of network provider. So how best you can utilize the providers. Indemnity plan, not required. Means you don't need the in-network out-of-net concept. You can go anywhere. HMO is required. Means if you wanted to go to out-of-network, you need a referral kind of, basically.
Yes.
PPO, not required. And POS, not required. Okay. Full range of benefits in indemnity plan, no. You will be paying more premiums. HMO, yes, as long as you are going to PCP with as a family doctor and getting a referral if needed to see out of doctor, so your entire family cost is very very less. So the more benefits. PPO, again, you are getting that freedom of choice of choosing a provider with a bit higher cost comparatively HMO. And POS, anyhow, combination of PPO and HMO, so it's again no. So which plan is best? Which plan is best out of these four? So Pranati, any guesses?
Yeah. HMO.
HMO. Okay. So may not be again, why HMO, when they have HMO, if HMO was
Okay,
very
point.
really good,
Yeah.
very really good, they don't have PPO, POS concept, right?
Yeah.
People might have liked that, but again, I mean, everyone likes
PCP.
different
Yeah.
thing. So
PC,
every
PCP
plan is
also.
good.
Yeah.
Basically, every plan is good. Every plan is good based on user perspective only. If he has a more money and he does not bother, so he go for a PPO, right? You don't need to bother about he's really going to a PCP or not. But he's a family who has very less income, wherein he can go for HMO, then the entire family cost would be less. So there is nothing such, but again depends on the consumer who actually taking that kind of a plan.
Yes.
So let's see some questions on this. In an indemnity plan type, the member pays copay only. Is it true or false?
False.
Okay. What else he will pay?
Both coincidence and deductibles.
Yeah, he has to pay all the things if it is applicable. Okay.
Yeah.
If the plan of the member is HMO, generally the member can go directly to a cardiologist. Is this?
No. PCP. They have to go through PCP.
Yeah, it required a PCP for sure. In an HMO, the member needs to pay deductible.
No. Only
No
copay.
deductible, only copay, right? PCP referral is required if the plan of the member is HMO, right? Correct. In case the member encounters an emergency, will still a referral is required?
No idea. This
Uh,
one.
yeah, what they're saying is HMO, we definitely need a PCP, right? But
Yeah.
in case of an emergency, they don't need basically.
Okay.
Was there actually in the PPT as well, and the very beginning when we are talking about it. So, but just to get more idea, when we have questions, we'll think about all directions. Okay, if the member's plan is PPO, he can only see an in-network provider. Otherwise, the claim will be denied. True or false?
Only network. No.
What is a PPO? Preferred provider
Sorry,
organization.
yes.
You can go to in and out of network
Yes. Yes.
thing. Okay, it will not be denied. But in the same case of HMO, it will be denied if you see a doctor. Just like that,
Yeah.
without an emergency case, if you go and see a out of network provider, the claim will be denied
Yes.
in case of HMO. Okay. So you just try to have this, this remember, like, names at least. What are managed care plans? If we talk about US history, when the plans has been, they started providing, the first plan was indemnity plan. Okay. Wherein, like in India, similar to that, but the cost of premium is bit high. And there is no concept of in network and out of network and all. Okay. And when they started moving towards managed care plans, means better management over here based on the people need and the consumer needs, wherein you have HMO, PPO, POS. And one more thing is an exclusive provider organization. It's again a combination of PPO and POS, they say. Okay. But again, you will get confused. That's why I did not added that thing here. Okay. But yeah, it's self-explanatory basically. Okay. And specialty services, like